Okay, I call the City of Franklin Board of Health meeting to order, November 9th, 2021. At this time, we're still waiting for Alderman Barber, Pat Nissan, Peggy, and Peggy. Otherwise, everybody else is here. So the first business would be the approval of the minutes of June 14th.
I did send those out. Hopefully everyone had a chance to look at them.
Anybody want to approve?
Yes, I'll make a motion to approve.
Okay, Lori, and second Amy. Okay, any discussion? Hearing approval of the minutes of June 14th. Say aye.
Aye.
Okay, it's unanimous. We will then move, there are no citizens, so we will go, and I don't believe there's any unfinished business. So we're going to go right into new business right now. Before we start, is there any new business that wants to be brought up? Okay, then the first on the agenda would be personnel updates.
Yeah, and right before we jump into that, I just want to quickly go over this memorandum that I handed out to everybody from Peggy Steno, who's the Director of Administration here in Franklin. Updated Code of Conduct and Ethics for elected and appointed officials. So they dropped these off for us to go to sign. They said couple of options. You can sign it and drop it in the drop box, which is out by the main door if you want to do it that way, or if you want to do it that way, or if you just want to bring it back to the next Board of Health meeting, either one is fine. My Cliff Notes version of this is it's sort of like the golden rule, kind of be nice to each other, be nice to citizens if they come in to comment, remember that you represent the city in the meetings, that kind of thing. But I believe the last one was many, many years old, so this is just an updated version of that.
So this does not have to be done in the presence of clerk or that?
No, it does not.
Okay.
No. Okay, so personnel updates. Lori, public health nurses, she'd been here for 31 years at the time that she retired, basically to be a full-time grandma. So we had a 0.5 position. We posted initially in July. I had a few candidates, but the consensus from myself and the HR director really actually wanted part-time work. It just kind of seemed like it was a job that was available, and they would probably be leapfrogging to something else in the near future. And given that I was about to go out on leave, onboarding was not going to be the best timing. So we passed on those two and reposted when I came back. Of those, we had two very qualified applicants, and we offered the position to an individual who lives in Franklin. She's been a nurse for 25 years, most recently in cardiac rehab with Froedtert. And she will be starting in cardiac rehab with Froedtert, and she will be starting on the 22nd of November. She works part-time, only wants to work part-time, and is good with the hours. So she'll be working kind of the same schedule that Lori had, 3 days 1 week, 2 days 1 week. Lori had 3 days 1 week, 2 days 1 week, and then doing a lot of helping with communicable disease immunizations, of course, but then also taking on some programming, things that Lori used to do as well. So that gap will be filled, which is good for our staff to have another body in the office. Then we also...
Did you say the name?
Amy Kremski.
Oh, yeah, all right. In my head, I was like, I feel like I know this person, like the description you're saying, cardiac rehab.
Yes.
Okay.
So one of the things was that she had said that when she goes for walks with her family, she frequently would see people in the community that she would be helping. And she was very outgoing and very eager to do public speaking and education and that kind of thing, which is kind of exactly what we needed. So she was a pretty good fit. Then we also brought on through our temp agency Maxim, who an epidemiologist. His name is Christian. He does work out of state, but he is working for us 20 hours a week for the next several months, doing the data analysis of and statistical analysis of all of our community health assessment data. So none of us in the department currently have an epi background. So being able to have some extra funding from the COVID money to bring someone in, because a lot of what we're doing with the community health assessment is considered COVID recovery. So we're allowed to use the money for that. So he'll be helping us out right now. He's transcribing a lot of our key informant interviews. Once we have our survey results, he'll be doing the data analysis of those and comparing them to the previous surveys, looking for any statistically significant increases or decreases in things. So we're excited to have him working for us and helping before in Franklin. And then on the contact tracer side, unfortunately, we had to bring some back because we were having that influx of cases. So we're down to one through all of the summer, but then we brought back 2 more. So actually 3 more. So we're at 3 full-time and 1 part-time. 3 of the 4 had worked for us previously, so it was just bringing them back on and getting them caught up with where things were in Franklin, but it wasn't difficult to onboard them because they'd already been working with us. And were able to hit the ground running with us in the school district, so it was nice to bring. So that's it on that. If anyone has any questions.
No questions on personnel updates. We'll go right to community health assessment update.
So we're working our way through that. We've done 21 key informant interviews, so we identified people in the community that we thought were individual things within the community, did in-person interviews with them. We also have, the hospital system does something called a community health needs assessment. It's a survey that they put out for their CMS requirements, and we get the Franklin specific data from that. So those questions are generally the same every 3 years, so that's part of what Christian's going to be looking at between the last time they did that and this time. The same with the YRBS, that was just conducted in the schools a couple weeks ago. So again, this time with last time and looking for in the schools a couple weeks ago. So again, this time with last time and looking for changes. We also have our own community health assessment survey that Lauren has been putting out in the community. We have about 150 responses so far, so that's going relatively well. And then the focus groups we started today. Amy was kind enough to help us facilitate them. So I don't know if you want to give quick cliff notes of how today went.
Yeah, absolutely. Today went great. We had 3 focus groups this morning. We met with the senior citizens, followed by some representatives from the school district, and then some great feedback. Some common themes were for the challenges and barriers. A lot of people brought up transportation as a big barrier. Some other things with challenges is that Franklin wasn't very diverse, so making sure that, we were, and what else? There was just so much information this morning, but it was great, and everyone was very talkative, and the conversation, I think, flowed very well. So I think Lauren got a lot of great information. Everything was recorded, so she said she was going to put that information together. But it was, and so much information together. But it was, and so much positive feedback. A lot of times people really highlight the negative things, but everyone was really excited to be a part of it, and everyone had good things to say about the health department and what a great job they do in handling of COVID, and so.
Good job.
Yay. Someone likes us.
Yeah.
Okay, moving on.
Sure. If we're done with community health stuff, I was just thinking, maybe not all the football parents, but
Right.
my mind was somewhere else. Okay, the grant update.
So since we last met, we had put out for the extension of that grant, and we were awarded it at the end of September. So years 6 through 10 will take us through September of 2026. And in your little packet here, Ellen put together a little one-pager kind of on securing the funding. It's $625,000 over the course of 5 years. You can see our group of partners on the bottom. We try to get representatives from all of those sectors at the table. The great thing about this is that we get so for the $125,000 we get for the grant, we also get matching in-kind donation from people's time and energy of at least $125, usually more than that every year. And then looking at what we're focusing on right now is underage and misuse prevention are the two things we're looking at in this 5-year grant cycle. So more to come on that. We had a wonderful kind of kickoff meeting last month. We had one of those graphic artist designers come into the meeting and kind of pictorially graph the meeting as it goes along. If you haven't been in one of those meetings, they're really, really neat. So once we have that, we're going to display it in here, so everybody can kind of see all the work that that group is doing. So that was really neat to be able to bring her in and do that for us.
That's that. We're going to move on to budget update.
Yeah, so I included in there the budget narrative. This is what I have to give to the finance director as well as the mayor and the city administrator every year. So the key changes, and there's even changes. I have to have this written in July, so things are always changing. So in addition to the key changes for 2022, I talked a little bit about the COVID grant funding, and I but in addition to that, we also received money from the American Rescue Plan Act. It's $460,000 to use from now through the end of 2024. We also got, I reference in here the CDC cooperative agreement that works that we have through 2023, and a third grant to supplement immunization services of $70,000 through the end of 2024. So all of those will go a long way to help us with the recovery piece of the community health assessment, the community health improvement plan, workforce development to be able to bring in staff and keep those temp staff on board for a little bit longer as we need them. The immunization support is great because the immunization grant that we currently have is basically for children. So up until very recently, we couldn't use that for anything COVID related. So this grant will help us be able to, if we need, improvements in refrigerators or data loggers or storage cubes, supplies, because for Moderna, for example, when you're giving half a dose, are not syringes that can measure 0.25. They're ones that can measure 0.5. So we have to then find syringes to stockpile for those. Same thing for Kid Pfizer. Sometimes the needles that you get are not the needles that you need. So this gives us extra money to be able to kind of stockpile supplies for that we didn't have to, that we didn't know if we would get the DFC grant. So we were looking at other ways to fund Ellen's position if for some reason we hadn't gotten that, but we don't have to worry about that at this point. The staffing updates that are in there, we put in something called a clinic nurse for surge capacity. So if at some point after 2024 something like this happens again, or we have a staffing shortage for whatever reason, we do have a paid position on the books that we can use grant funding from some of our more static grants that we get every year. To bring in a nurse to help with either communicable disease follow-up or immunization clinics. So basically having the ability to bring someone in on call that we can pay if we need to. So that would be a great help to us if we need to. So that would be a great help to us. We also are looking to do an internal restructure a little bit to create, it's called a public health program manager position. And this, I'll get into. Part of the way health departments are moving right now is less and less on widget counting direct services. Not that you don't do those anymore, but that's just not how you're classified by the state. It's more in what the value of your program is to the community. So how do you know that you need to have that program? What are your results? You know, how are you doing quality improvement to make it better? What are your baseline performance management metrics, that kind of thing, which is something that this health department hasn't had to do before. So it's a little bit of shift in thinking and how programs are managed. So it's a little bit of a different skill set, but it's something that with all of the things that I have to do, I also can't keep track of all of those things as well. So it will be an internal transfer. Is eligible based on the criteria of the job description that can apply internally, and if someone comes forward and they meet the criteria, we'll internally transition them to that role. If not, we'll just wait. Got a few years before our next 140 review where we have to have kind of all of this lined up. It would be nice to be able to do it sort of as a slow process and not have to do it kind of all very quickly at the end. So that's what we're looking at doing right now. I have two or three people within the department that would be able to do this. Not a problem. It's just a matter of if they're interested in transitioning kind of into that type of role. Like I said, it's a different mindset, less on direct services. So it's a little bit of a hardship for some people who have been in public health for a long time.
If there's nothing else in budget, why don't we go right into the 140 then?
Yeah, so way back in late 2019, early 2020, we had to do our 140 review, which is Chapter 140 is the state statute that determines the leveling of health departments in Wisconsin. I gave you the statute. So the yellow highlight is what everyone has to do, so level 1. Then the green is what we have to do in addition to the yellow. And this particular chapter was rewritten in 2019. Where before, again, like I mentioned, it was sort of widget counting. How many services do you do? And that was how you determined if you were level 1, 2, or 3. And now they don't really care how many services you do. It's just how in depth do you do them. And what are you looking at to determine what services you offer? There's a lot in here about equity, a lot in here about performance metrics. So again, putting all of that together with the notes that we got from our review team, kind of showed the gap that we had in the department and needing to fill that gap with someone who could be looking at those types of things.
What level are we currently?
We are a 2,
Okay.
and we are a 2 because of me. Because I do not have a master's. If I did have a master's degree, we could probably be. It would be hard with the new 140.
There's other ramifications you have to meet.
Yes. So like the state agent program. So Angie and Jamie going out and doing the restaurant inspections. That's a requirement of a level 3, not a level 2. But we do it. So we do a lot of. Bill did not have a master's degree either. So it was always this position that kind of held the health department back from leveling up. Not that we don't do the services, it's just on paper. So we were officially approved as a level 2 health department in December. So February is when they came to check us. In December is when they said we were good. Now, November of 2021 is when they're going to come give us our fancy certificate. So on the 18th, a couple of representatives from the state will be here. They're going to come to one of our staff meetings to present us with our new 140 certificate. So it's official, almost 2 years after we did it, but we will have the official document saying that we are a level 2 health department again.
Does anybody have any questions on that? Anything else on that, or on administrative reports?
Nope.
Then we'll go right into public health nursing report and the City of Franklin COVID update.
So COVID, the fancy graph here. It's kind of all over the place. I mean, when you look at it the last 3 months, pretty much how the state has gone up and down, up and down. I don't want to say that we're coming down because it seems like we might be going back up a little bit the last week. Not really sure why or how, or if it's just a momentary blip. But it was noticed by everybody on our call. It was noticed by everybody on our call this morning that the last week seemed to be an anomaly again. What I will say though, so our vaccine rate is still good. When we get to, if you look at the back of the first page, you'll see the COVID vaccine data. And when you look at Franklin, you'll see some pretty astronomically high numbers. And we didn't quite know why they went up that high. And it was because the state's report booster doses. So it was adding the booster doses into the actual doses.
Darn it.
So it's not horrible. If I pull them back out, our percent complete is right around 74%. So it's still well above the county and the state. So we're still doing. It's still well above the county and the state. So we're still doing well for adults. Children, it's a little bit harder to grasp because there's not a census data category for that age group, and we can't really use school district data because we have the 3 blended districts, so it's hard to really use school district data because we have the 3 blended districts, so it's hard to pull all that out. But I know that Lori and Molly have said that for the 12 to 17-year-olds, we're doing pretty well.
Yeah, I would say at the high school, we're close to about 2/3 vaccinated, 7th and 8th grade population, but we're continuing to get new batches of kids continuing to get vaccinated, so got a solid chunk.
Yeah, so if you look at page 3, where I flipped the graph sideways, we were able to pull the data today and pull out your doses that you see on the side there. So 73.5% fully vaccinated on the adult side. And the booster doses, there's a fair number of people that have gotten those. So we're getting there. And then the back page shows you the breakdown of vaccine by age. So kind of the full landscape there in the green. And then by age, the number by age for the 12 to 17-year-olds. And then we will have, starting next week, so we're doing okay. We did drop into the moderate high level on the Harvard side last week, so we're hanging tough right there. It might tick back up.
And what about flu vaccines?
So flu vaccine, we have done just over 800 flu vaccines so far this year. The vast majority of those have been high dose flu vaccines for our seniors. We don't bill a lot of insurance outside of Medicare, so a lot of individuals who are under that age choose to get vaccinated elsewhere rather than pay us and have to go through the backdoor process of requesting a reimbursement. But we have given more flu shots to this point this year than we had last year. Last year at this time we were just over 700. This year we're a little over 800. We have one clinic left next week on the 17th. scheduled clinic, I should say. And then we move into doing, as everybody comes in here to pay the taxes, we put all sorts of signs out and say, come down and get your flu shot. So it's just kind of
Here.
run right down from the treasurer's office into our office. So we usually get pretty good traffic coming through for that piece.
Are you able to find out how many people get it from the pharmacy?
The Wisconsin Immunization Registry of flu shots, the number of people who have gotten them. I don't know if there is a WER report that breaks down where they got it, but we can get the actual number of people that did get it, yes.
They batch them from the pharmacy, so it's pretty delayed. You
Yeah.
don't get them as quickly as when
When
you
you
give
would
them.
like to have those, that
Yeah,
information.
For sure. Yeah.
Okay, what about other communicable diseases?
So I've got that handy spreadsheet in there. So total referrals to the health department, so that includes total referrals to the health department, so that includes everything, including animal bites, social service referrals, lead, high-risk newborns, all of those combined in there. So I gave you the last 4 months to kind of see where we've been, and you can see the last 4 months to kind of see where we've been, and you can see when things with COVID really started to take off again. Where July we had 162, and then back up over 400 for the amount of referrals coming in. The back page of that is specific to communicable diseases, and then kind of the big increase when COVID took off again. So COVID by far is the main driver of that, but we do have about 100 chlamydia, just under 100 chlamydia cases this year, almost 30. So the latent TB is actually a little bit concerning on staffing level wise, because those particular clients are with us for 6 to 9 months. A lot of directly observed therapy, so it's, one nurse, kind of spending 1 day a week just running around to different houses watching people take medicine. So that is very labor intensive. So bringing on that other part-time nurse will be very helpful in office, since Kim spends the majority of 2 days of the week out of the office just doing these home visits.
Any other questions on communicable diseases? Not human service referrals.
So we do have a home that we have been working on since early summer. On July 27th as unfit for people to be inside of it. It was an elderly woman and her 2 adult children living in the home. And since that time, people continued to go into the home, so I did have to issue a board. People continued to go into the home, so I did have to issue a board-up order with the approval of the Common Council in October. So the home is now actually physically boarded up on all sides so that nobody can gain entrance to it. It is a home to the point where you do have to wear a full hazmat suit and a respirator to be inside, to be safe. And estimates around $80,000 to $100,000 to remediate. So right now, this is a family that we dealt with in 2014 for a very similar situation. Went through the process of helping them get everything. It was about $30,000 worth of damage. A conservator was appointed to the homeowners, the elderly couple. The husband is now in an assisted living facility, but they have a conservator to help them manage their finances. So the conservator at this point is looking to try to get finances. So the conservator at this point is looking to try to get permission from the courts to sell the home, to get assets so that the elderly woman who owns the home can be put into assisted living, and then those funds would help pay for her care within that environment. Right now running into some road, having the ability of the homeowner to also appear at the court case as well, but it was by far one of the worst that I have seen in my 12 years of public health. So complicated situation, complicated family, still ongoing. Once it's clean, that 80 to 100,000 was just to remediate the building, to clean it, get rid of the infestation, and then it would have to be determined if it was structurally sound to even move back into it. Right now it hasn't been inspected by our inspection department because they've deemed it too hazardous to go inside. So we don't even know if they somehow did have the money to rehab it, if the structure itself would even be salvageable. I don't feel that it is, being inside of it myself. It was very squishy, that particular process. I don't know what of the frame of the house and the floorboards and everything could be salvaged. So yeah, working with many different departments and the conservator, the court system, this family, burned some bridges in 2014, staying at hotels around the area in Franklin and Oak Creek. They lived the same lifestyle when they went to the hotel as they did within their home, and so their names are still on lists at the hotels that they won't rent to them. So they've been staying with friends, or unfortunately having to live in their car. There are animals involved, so it's just a sad situation. But it's taken a lot of resources from our department. Carol, myself, Kim, Angie, we've all spent many hours dealing with them, and it feels like haven't made much progress. So hopefully they can, the next court date is November 30th, so hopefully there'll be a resolution at that point and we can keep moving forward.
So the children were adults, right?
Yes.
Okay.
There is nothing, they're living at home, that it's not that they have physical or mental disabilities or anything like that. They could be on their own, they just chose not to be. So, yes.
Sad. Okay, what about community health programs? Okay, what about community health programs?
So we were able to start some of those back up this year. Our Stepping On class, which Carol runs, it's for seniors over 65, and the purpose of it is to help them gain a little bit of strength and balance, to help them. A lot of people join the class because they had a fall, or they're afraid they're going to have a fall in their house. Normally we offer the program twice a year, but because we took last year off, there was a pretty high demand. So we are doing 3 programs this year. They're 7 weeks long, and we have, due to space constraints, we use the Phaedra room in the library. So we have 15 participants, just so we can spread everybody out nice and safely. Usually we would do 20, 25, 30 people in a class, but we cut it down so everybody could spread out and be safe. But we're doing 3 this year instead of 2. We also started a program called Mind Over Matter, Mind Over Bladder, which is, there is a health education consultant with the Aurora system who wrote a book about bladder and bowel. 3-part program that seniors come to. We keep that class pretty small, not just for health safety reasons, but also because you're talking about things that are a little bit private, and you don't want to be in a large group setting, because people then typically aren't going to share their stories or their issues. So we weren't really sure. We did their stories or their issues. So we weren't really sure. We did this just sort of Carol had seen this program and thought it might be something that our seniors would be interested in. And we have a waiting list that's probably about 60 names deep.
Wow.
We have offered it twice. We're going to offer it again December, and have a waiting list that will go well into next year. So it's been very successful. There's some courses that Carol can take so that she can be a facilitator of it, so we can kind of keep it going. We don't always need to work on the schedule with the representative from Aurora to come to our programs, but I think it's also kind of showing that people just want that connectedness kind of thing again, especially the seniors, to be able to get out and do things again. So good that we can start doing some of those things again. And then we had Trunk or Treat right before Halloween. Had about 450 families. We tried to do a staggered start, tried to really corral them one way in, one way out, control the crowd as best we could. A lot of interest from companies wanting to do it. We ran out of parking spaces for the trunks. So we offered kind of last minute if they still wanted to come in to decorate a pumpkin, and then they offered kind of last minute if they still wanted to come in to decorate a pumpkin, and then there was a pumpkin carving contest at the end for any business that wanted to do it. So looking forward to continuing doing that with the library every year. So that was a good success story too.
Any other questions under public health? Now we'll go into environmental health.
So for our DATCAP licensing program, much like the 140 review for the whole health department, the state agent program gets a formal evaluation DHS every 3 years. So this is our turn to be audited. So we'll have a formal program evaluation on Monday the 15th. So there'll be somebody on site from DHS going through the program with myself and Angie to make sure that we're doing all of the things that we agreed upon. To make sure that we're doing all of the things that we agreed upon in our agent contract. And then also that week, Angie will have her standardization, which happens every year. The state will send one of their agents and they'll shadow Angie at a variety of establishments to make sure that she is doing things the standardized way that the state wants us to for inspections, and then she becomes the standard for our department, and then she trains Jamie on what the standard is. So every health department that is an agent has a standardization process every year. So that will all happen next week. And there's specific restaurants or places that she has to go. So it can't just be like, I'm going to pick something super easy. It has to be things like they'll go someplace that has like sushi, or someplace that has
the sushi place on Highway 100.
Yeah, so it's going to be someplace that, or like an Arby's where they have, where they're like cutting the meat, and it's like things that have a little bit extra hazard, I guess, that would wanting to be checked. So,
How quickly do they have to do that after an establishment opens in the community?
So there are, if it's a remodel or a new build, we'll go through and do a pre-inspection before they open, and then we sign off on that for the inspection before they open, and then we sign off on that for them to open, and then they get put into our normal cycle. We try to do everybody twice a year. Sometimes we get it, so we're obligated to have to do it once a year. We try to get to as many things twice a year as possible. Sometimes for a variety of reasons we don't. We just have me as a point one. So so Jamie really does kind of our weekend, evening. She does some plan review things at home, but Angie does 99% of all of our inspections. So one of the things that I'm sort of hoping to be able to do in the near future is get some sort of help for Angie in some way, shape, or form. That program, when it was created for Franklin, is paid through the fees for the licenses and the inspections, and so it's not off the levy, it's off of the fees that we collect for that program. So it's hard to increase staff because you don't necessarily want to increase fees on the businesses. So trying to figure out a way to get more help so that we can be able to keep up with the continued is we want more businesses to come to Franklin. So as more businesses come, that our hotels, motels have a plus too, and we're not getting more staff, so it's just more things to do with the same amount of people.
Now, the inspections that are going to happen next week, these establishments aren't forewarned, are they?
No.
How do you do that strictly during the day then, when a lot of them don't open until the evening?
Most places are open. And in those instances, we do sometimes have to schedule things, just for the fact that if it's a place that opens, say, at 4 o'clock, and that's going to be like right in the middle of a dinner rush. We don't want to be there during their rush because it's hard for us, but it's also hard for them, and it's hard for us, but it's also hard for them, and we don't want to make their life harder by having to walk around us to try to get things done. So in those instances, we do sometimes schedule them in advance so that we can do it and we're not in their way.
Okay.
But we want them to be making food at the time, though, because we have to check, that they're hot holding, cold. Be making food at the time, though, because we have to check, that they're hot holding, cold holding, food prepping correctly. So you want them to be doing something while you're there.
Okay, and the last would be environmental health referrals.
So the only thing I really had there is I was just gonna touch briefly on dog bites. So for 2021, we've had 28 dog bites. All of 2020, we had 22. So we've still got 2 months to go, and we're already ahead of that. We've had a few bites this year. One that was that the police actually ticketed as a vicious dog. So we've had to have several pet owners, based on city ordinance, to keep their animal in Franklin. They've had to make modifications to their property or agree to keep their animals in a certain concern that we're starting to see is the increase in places that want to have dog parks, whether it's an apartment complex that wants to add a dog park, or there's a new development being discussed for the vacant lot over on like Loomis and Highway 100 across the street from Walgreens and across the street from the scary gas station that closed. That vacant lot.
There.
There's a development that wants to go in there, kind of like a community center place with a skating rink and a band shell and a splash pad and things like that. But they also want a dog park. So there's a lot of dog parks, and so I feel like I keep sending
A bunch of kids and then a dog park.
Yeah. And like the one place was the dog park was next to the basketball court at the apartment complex, and I'm thinking bouncing ball, lots of people running back and forth, and unleashed dogs. What could possibly go wrong?
Good
So
thought.
I feel like I keep writing this, and it's not that I'm anti-dog park, it's just I want people, if they're putting in a dog park, to actually think about kind of the responsibility that goes along with it, and if, bad things can happen in them. And Franklin has a lot of green space and a lot of nice trails, so we're not super like.
Good point.
So that's just on my radar.
Are you getting a lot of dog bites on the trails?
Not as many as you would think. There's usually a handful every year, and usually what it is people they kind of go off the trail and they're playing fetch, and then the animal's like off leash and kind of running around, and then a biker goes by or someone's running, and then the dog kind of gets spooked, and so it's usually things like that happen. So a lot of times it's what we consider a provoked bite. It wasn't the animal like being menacing or mean. It got spooked, but at the same time you should have your dog on leash. And,
Right.
Yeah.
But yeah.
There's nothing else. I need a motion to adjourn.
I'll make a motion to adjourn.
Second.
Second.
All in favor?